Over the last several weeks, we've put into place several measures that have changed in some respects the way we all live our lives. And we know that this has been extremely hard for everyone. And I want to thank once again the people of the Commonwealth for their patience with respect to all of this. I just want to emphasize that all of the measures that we've put in place have all been about flattening the curve, meaning we've been trying to avoid having cases peak all at once here in Massachusetts, which would overwhelm our healthcare system. And based on the experiences of other countries, we've always expected that there would be a surge here in Massachusetts. So for the past few weeks, we've had a talented group of experts working through the command center with academics, healthcare experts, and public health folks to plan a coordinated response based on the modeling associated with how the surge might appear, what it might look like, and how it would land. And I just want to say that Dr. Fauci said something interesting about projecting the surge the other day, where he said that as every day goes by and you collect more data, not just from your own experience, but from the experience that's going on in other parts of the world, you can rethink and adjust your model accordingly. And that's exactly what we've been doing. But one of the major points I want to make today is the other guidance that he and others have put forth is that people should plan for the worst and do everything they possibly can to make sure they have the capacity to deal with that, and then make adjustments based on changes in experience, changes in data, and changes in other countries and other places' experience as we go. And that's exactly what we plan to do. The medical advisory group that we worked with modeled out with us when we expect to have the surge, how many cases we can expect, and what level of care people will need. We developed these models based on the experience in Wuhan, China, and adapted that to reflect Massachusetts' population and hospital bed capacity. An epidemiologist at Harvard, at the University of Guelph, which is in Canada, Northeastern, and the Command Center's Medical Advisory Committee have been working through and sorting through this data to come up with what we anticipate to be the latest on how this is going to look. We estimate at this point in time that the number of confirmed cases of COVID-19 in Massachusetts will range somewhere between 47,000 and 172,000 cases during the course of the pandemic. That's about 0.7% to 2.5% of the total population of Massachusetts. And at this time, the modeling indicates that hospitalizations would potentially peak between April 10th and April 20th. And the current fatality rate in Massachusetts is lower than in many other parts of the country and the world, currently running at approximately 1.5% of those infected. It's important to remember, as we've said many times, that roughly 80% of those who do become affected have flu-like symptoms and that many have no symptoms at all. While this model is based on Wuhan's projections, we do anticipate Massachusetts' trajectory could differ for several reasons. For example, in Massachusetts, we have lower population density. We enacted strict social distancing standards and rules sooner than they did there. And we have a lower smoking rate. Our team also reviewed how COVID-19 impacts other states and other countries around the world and lined our projections and expectations up against those. And based on the projected infection rates, our team went to work figuring out what peak medical demand would look like and what it would require to support it. For example, how many people will need to be hospitalized, how many will need intensive care or equipment like ventilators, and for how long. Secretary Sutters and our administration have been actively engaging with our hospitals and the Massachusetts Health and Hospital Association on this issue for several weeks, so that we all are basically working off a similar playbook with respect to what's required to meet the projected need.